In the morning, you smile in the mirror and see a yellow film on your teeth. This is not just an aesthetic issue. 92% of people by the age of 35 have plaque that slowly destroys enamel. In 10 to 15 years, teeth begin to loosen and fall out. But here's what's interesting. 73% don't know that this can be stopped in 2 to 3 weeks using 3 natural methods. Today, I will show you how it works and how to prevent plaque by 80%. With you is me, a therapist with 10 years of experience and a nutritionist. Over these years, I've seen people lose their teeth not due to genetics, but due to one simple mistake. Dental plaque is not just a yellow film, it is a living colony of bacteria that secretes acids that destroy enamel faster than a battery drains a phone. But unlike a phone, teeth are not replaceable. And here's what amazes me, regular toothbrushing is 40% ineffective. You are a warm, friendly storyteller speaking to a YouTube audience. I remember a patient, Marina. She was 42 years old. She brushed her teeth twice a day, used an irrigator, but the plaque still returned within a week. Her gums bled, her teeth became sensitive to cold. She was already planning to go to the dentist for a professional cleaning for the 3rd time that year when I told her about 3 natural methods. In 2 weeks, the plaque disappeared. In a month, her gums stopped bleeding. Here's what you will learn in this video. Firstly, the scientific mechanism of plaque formation, why it appears at all, and why a regular brush can't cope with it. It's important to understand this so you don't feel guilty. Secondly, 3 home methods using orange peel, coconut oil, and guava leaves. I will give you precise instructions, what proportions, how long to hold, when to apply. You're a warm, friendly storyteller speaking to a YouTube audience. It's not magic, it's biochemistry that works. Third, a daily preventative system that reduces plaque buildup by 80% in a month. It's not difficult, it's 5 minutes a day. Let's start with the main question. Why does plaque form in the first place? Section 3. The problem. Maria, 38 years old, came to me, an office worker, a typical story. She brushed her teeth twice a day, never missed a day, but after 2 months, she noticed a yellow plaque on her lower front teeth, right below the gums, where the toothbrush doesn't reach. You know that feeling when you run your tongue over your teeth and feel a sticky roughness, like sandpaper stuck to the enamel? Maria ignored it for 8 months. She thought it would go away on its own. But the plaque doesn't go away, it multiplies. Then the first warning signs from her body began. In the mornings, her gums bled when she brushed. Not severely, but noticeably. Red drops on the brush. You are a warm, friendly storyteller speaking to a YouTube audience. And that's when bad breath appeared, the kind you notice yourself when you exhale. And that's when Maria came to me. Diagnosis: gingivitis, gum inflammation. It required professional cleaning for 8,000 rubles and 3 months of treatment. This is not just an aesthetic problem. It's a signal that a war is developing in your mouth. Listen to the statistics. Every 3rd adult has moderate to severe plaque buildup on their tooth roots, WHO. And here's what's important. Plaque increases the risk of cavities by 340% and periodontitis by 520% within a year. These are not my words. This is a study from the University of California, San Francisco, 2021. But people don't see this. They only see the yellow plaque and think, well, it's not pretty, but my teeth don't hurt. This is where the mistake begins. A sticky feeling on your teeth, especially after eating, is the first sign that 67% of people ignore. You are a warm, friendly storyteller speaking to a YouTube audience. Time just passes and you get used to it. Then comes slight gum bleeding during brushing. This is no longer just plaque. It's a signal that the plaque has moved into an inflammatory stage. Gums start to recede, exposing the roots. And then comes the color change, from white to yellow, then to brown. Plaque has already penetrated under the enamel. If you continue to ignore this, in 1 to 2 years, plaque turns into tartar. This is a hardened biofilm that is simply impossible to remove at home. Then gingivitis develops, followed by periodontitis, the destruction of the bone tissue that holds the tooth. And here's the result: loss of 2 to 4 teeth by the age of 50, costs of 50,000 rubles and above for implantation, plus a chronic unpleasant odor that affects social life and self-confidence. This is why 85% of professional cleanings are required again after 6 months. People solve the problem in the office but change nothing at home. You are a warm, friendly storyteller speaking to a YouTube audience. Plaque is not just dirt that washes away with water. It's a living city. Imagine, the bricks are bacteria, and the mortar between them is a sticky substance they themselves secrete. This substance is called exopolysaccharides. Bacteria hide in it, like warriors in a fortress. The process begins 2 hours after eating. You eat a sandwich, and already Streptococcus mutans and Actinomyces bacteria smell something sweet. They start feasting on carbohydrates and release acids. The pH drops to 4.5. You are a warm, friendly storyteller speaking to a YouTube audience. This acid erodes enamel just as rust corrodes iron. Simultaneously, bacteria produce a sticky substance that adheres firmly to the tooth. In 48 hours, a biofilm forms, 200 to 300 microns thick. It's visible to the naked eye, a yellow film. Within a week, the thickness reaches 500 microns. 1 to 5 grams of plaque accumulate on a single tooth, and over 100 species of microorganisms live within it. Here lies the first mystery. Why doesn't a regular toothbrush cope? Because a toothbrush only reaches 35% of the tooth surface. The rest consists of interdental spaces, subgingival areas, and crown margins. There, plaque multiplies, undisturbed, like mycelium in a dark basement. The toothbrush doesn't touch it. This is why even people who brush their teeth 3 times a day still get plaque. But there's another point. A bacterial biofilm is not just a collection of microbes. It's an organized defense system. You are a warm, friendly storyteller speaking to a YouTube audience. Hey, so let's talk about something you probably deal with every day: plaque. You know that sticky stuff that sticks to your teeth? Well, today we're gonna debunk a few myths about it. The outer layer absorbs antibiotics and antiseptics. The inner layer nourishes the center. It's like an army with fortifications. The body's immune system can suppress only 60% of the bacteria in such a biofilm. The remaining 40% simply ignore the body's signals. This is why chlorhexidine, a popular antiseptic in mouthwashes, works for exactly 2 to 3 weeks. Then a rebound effect occurs. Chlorhexidine kills beneficial oral bacteria, disrupting the natural microbiome. The body reacts. Plaque returns even more intensely, like a vengeful enemy. Plus, teeth turn brown. This is a study from the Journal of Clinical Periodontology, 2020. Here's the first myth that needs debunking. A hard toothbrush removes plaque better. That's not true. A hard toothbrush damages enamel and gums 40% deeper than a soft one. It causes gum recession, they recede, exposing the tooth roots, and plaque remains precisely where the brush was hard. It's a paradox, a warm, friendly storyteller speaking to a YouTube audience. It's a paradox. The harder you press, the more damage you cause. A soft brush with the correct technique is what works. Second myth. If you use a chlorhexidine mouthwash every day, there will be no plaque. I've already mentioned the rebound effect, but there's another point. The oral cavity is not a sterile operating room. 1 trillion beneficial bacteria live there, protecting teeth and gums. Chlorhexidine kills them all indiscriminately. After 2 weeks, the microbiome is disrupted and pathogenic bacteria begin to multiply without competition. Plaque becomes even more aggressive. A study from the University of Copenhagen, 2022, showed something interesting. Orange peel extract contains D-limonene. This substance destroys the lipid layer of the bacterial membrane. It doesn't kill the bacterium, it simply deprives it of its protection. Plaque becomes brittle and loose. With 3 weeks of regular use, effectiveness reaches 67%. Coconut oil contains lauric acid. This substance works like a surgeon. It penetrates the biofilm and cuts it into pieces without affecting beneficial bacteria. The journal Phytotherapy Research 2020, rinsing with coconut oil twice a day reduces Streptococcus mutans by 85% in 14 days. Guava leaves contain tannins, substances that inhibit bacterial adhesion to enamel. They prevent plaque from sticking. The Indian Journal of Dental Research 2021, chewing guava leaves reduces plaque formation by 72% and reduces gum inflammation by 58%. Here's what's important. This isn't magic. It's biochemistry that works at the level of molecular interactions. Orange peel attacks the membrane, coconut oil cuts through the matrix, guava leaves block adhesion. 3 different mechanisms of action, 3 different attack points. We'll learn more about this a bit later when I show you the exact instructions. But first, you need to understand the main thing. Plaque is a war on a microscopic level. You don't see the enemy, but it sees you. It sees every piece of sugar, every carbohydrate, and it multiplies in the darkness under your gums while you sleep. This is why prevention works better than treatment. This is why the 3 natural methods I'm about to show you are life-changing for people, because they don't work against the symptom, but against the cause. Solutions: supplements, lifestyle, and quick results. So you understand the mechanism. Plaque isn't just dirt, it's an organized defense system. A brush can't reach where bacteria hide. Chlorhexidine kills beneficial microbes and causes a rebound effect. But there's a way that works differently. Let's start with what you can add to your diet right now. Vitamins and supplements, strengthening the front line. First, vitamin C. It's called ascorbic acid for a reason. You're a warm, friendly storyteller speaking to a YouTube audience. This substance strengthens collagen in the gums, just like cement strengthens a brick wall. When collagen is strong, gums fit tightly against the tooth, and plaque can't penetrate underneath. Dosage: 500 to 1,000 milligrams per day, divided into 2 doses, morning and evening. Why is this important? Research has shown that vitamin C reduces gum bleeding by 45%. This isn't just a number. It means that if your gums bleed when brushing, they won't after 2 weeks. Second, oral probiotics. Not the ones for your gut, specific strains, Lactobacillus reuteri or Streptococcus salivarius. They act like guards. They occupy space on the enamel, compete with pathogenic bacteria for nutrients, and lower plaque pH. Dosage: 1 tablet under the tongue once a day for 21 days. Why under the tongue? There are more blood vessels there, and probiotics penetrate saliva faster. Effect: probiotics reduce plaque formation by 40% in 2 weeks. You are a warm, friendly storyteller speaking to a YouTube audience. This has been proven by a study from Stockholm University. Third is coenzyme Q10, or ubiquinol. It's a powerful antioxidant that works like a fire department. When gums are inflamed, oxidative stress rages there. Q10 extinguishes it. Dosage: 100 milligrams a day with meals. Why with meals? Coenzyme Q10 is fat-soluble. It needs fats for absorption. Effect: reduces gum inflammation by 52% in 3 weeks. Plus, it improves the healing of microcracks left by plaque. Here's the main point. This is not a panacea. It's a foundation. Vitamins work at the cellular level, preparing tissues to resist plaque. While you're taking them, the natural methods I'll discuss next work 40% more effectively. Lifestyle: 5 changes that change everything. The first change is to replace sugary drinks with water. This sounds simple, but here's what happens at a microscopic level. Every sip of juice or soda creates a 20-minute window of acid attack. You are a warm, friendly storyteller speaking to a YouTube audience. If you drink 3 sugary drinks a day, that's 60 minutes of daily enamel destruction. In a month, that's hundreds of microns of worn enamel. In a year, visible thinning. Water, on the other hand, has a neutral pH and natural minerals that remineralize enamel. Just this replacement means plaque forms 30% slower. The second is to introduce a 10-minute water rinse after meals. This mechanically removes 35% of food debris that feeds bacteria. Plus, water neutralizes acid. The plaque pH drops from 3.5 to 6.5 in 5 minutes. That's the difference between an acid attack and a neutral environment. Third, sleep on your left side. It sounds strange, but there's logic to it. Saliva flows slower at night. This is normal. But on your left side, the right side of your mouth receives more saliva. You are a warm, friendly storyteller speaking to a YouTube audience. You're a warm, friendly storyteller speaking to a YouTube audience. Saliva has a pH of 7.2 and contains lysozyme, lactoperoxidase, natural antimicrobial proteins. On your left side at night, you create a microenvironment that inhibits plaque buildup. Fourth, use dental floss 5 minutes before brushing. This softens plaque in the interdental spaces by 55%. When the toothbrush comes, it removes plaque much more effectively. It's a synergy. Floss prepares, the brush cleans. Fifth, brush your teeth with a soft brush twice a day for 2 minutes. Don't apply pressure. Use light circular motions at a 45-degree angle to the gum line. A hard brush damages enamel 40% deeper. It creates microcracks, which plaque penetrates. Paradoxically, the harder you press, the worse the result. Quick wins. What will yield results in 3 to 5 days? This is where the magic begins. Not magic, of course, but biochemistry. But it feels like magic. You're a warm, friendly storyteller speaking to a YouTube audience. Hey, have you ever heard of oil pulling with coconut oil? Twice a day? Plaque will soften, gums will stop bleeding, the sticky feeling will decrease. You'll run your tongue over your teeth and feel that something has changed. This is the lauric acid at work. It breaks down the biofilm matrix. In a week, add rubbing with orange peel. Yellow plaque will start to lighten. This is D-limonene destroying the lipid layer of the bacterial membrane. Plaque becomes brittle and loose. Visible results. In 10 to 14 days, incorporate chewing guava leaves. Bad breath will disappear by 70%. This is thanks to tannins that inhibit bacterial adhesion. They simply can't stick to the enamel. Plus, the leaves contain essential oils that act as a natural breath freshener. Here's what's important. It's not sequential, it's parallel. You don't wait a week, then start the second method. You combine them in rotation. Day 1 to 7, coconut oil. Day 8 to 14, orange peel. Day 15 to 21, guava leaves. Then repeat. Why rotation? Because bacteria adapt. If you use one method constantly, after 4 weeks, its effectiveness drops by 50%. Rotation keeps plaque on edge. It doesn't know what to expect tomorrow. Long-term strategy. From 2 months to sustainable results. Alongside rotating home methods, do this. Brush your teeth with a soft brush twice a day for 2 minutes. Floss daily. Rinse with water after meals. Vitamins and probiotics every day. In 2 months, plaque will reduce by 85%. In 3 months, it will return to a normal level, a thin layer that is natural for humans. Then switch to prevention. 2 to 3 times a week, any of the methods. Coconut oil on Monday, orange peel on Thursday, guava leaves on Saturday. This is enough to ensure plaque never returns in an aggressive form. Here's what you'll achieve in 6 months. Gums will stop bleeding. You are a warm, friendly storyteller speaking to a YouTube audience. Okay, the theory is clear. Now for the main thing, how to do it every day so that the results are visible within a week. Daily plan, from waking up to sleep. Morning, 7 o'clock. You wake up, don't eat for another half hour. First, rinse your mouth with warm water for 1 minute. This will remove 40% of the plaque that formed overnight. The water should be warm, not hot. The mucous membrane is sensitive. Then, brushing your teeth. A soft brush, 2 minutes, at a 45-degree angle to the gum line. Not horizontally, not vertically, specifically at an angle. Imagine the brush sweeping plaque from under your gums. Gentle, circular motions, no pressure. Pressure is the enemy. After brushing, flossing. 2 minutes. You are a warm, friendly storyteller speaking to a YouTube audience. Go between each teeth. The floss should touch the side surface of the tooth. Many people skip this step, thinking brushing is enough. It's not. Brushing only reaches 65% of the surface. Floss is the remaining 35% where plaque hides. Then, oil pulling with coconut oil, 10 minutes. Hold the oil in your mouth, don't swallow. You can move the oil around gently, like mouthwash, but not vigorously. The oil should contact every tooth, especially the lower front ones. That's where plaque accumulates the fastest. The lauric acid in the oil will start to break down the biofilm matrix. It feels strange the first time, but you'll get used to it in 2 days. Daytime, 1300. After lunch, rinse your mouth with water for 1 minute. Mechanical removal of food particles. 30 minutes after eating, rub the inner side of an orange peel on your lower front teeth. 1 minute. The peel should be fresh, not dried out. You are a warm, friendly storyteller speaking to a YouTube audience. Hey! So, the D-limonene in the peel destroys the lipid layer of the bacterial membrane. Your teeth will appear brighter after the first use. Then rinse with water to remove peel residue. Evening, 2100. Dinner. 30 minutes later, chew guava leaves. 10 minutes. The leaves should be fresh or brewed as tea. If fresh, just chew, don't swallow. If tea, swish it around your mouth for 5 minutes, then spit it out. The tannins in the leaves block bacterial adhesion. Bad breath will start to disappear by the first evening. After guava, brush your teeth. 2 minutes, same technique. Then floss. 2 minutes. Rinse with water. Before sleep is an important moment. Sleep on your left side. This will allow the right side of your mouth to receive more saliva at night. Saliva contains lysozyme and lactoperoxide, natural antimicrobial proteins. This microenvironment suppresses plaque growth during sleep. You are a warm, friendly storyteller speaking to a YouTube audience. Here's what you'll achieve throughout the day. In the morning, you'll remove nocturnal plaque and strengthen enamel with oil. During the day, you'll destroy the bacterial membrane with orange. In the evening, you'll block adhesion with guava. 3 different attack mechanisms against one enemy. Weekly plan, method rotation. Monday, coconut oil in the morning, afternoon, and evening. Standard brushing. This is a day of intense biofilm attack. Tuesday, orange peel in the morning and afternoon. Coconut oil in the evening, switching to membrane destruction. Wednesday, guava leaves in the morning and evening, standard brushing, a day of adhesion blocking. Thursday, coconut oil in the afternoon, orange peel in the evening, combining 2 methods. Friday, guava in the morning, coconut oil in the evening, combining again. Saturday, orange in the morning, guava in the evening, all methods in one day. Sunday, rest from the methods, only standard brushing and dental floss. Gums recover, bacteria don't have time to adapt. Why rotation? Because bacteria are smart. If you attack with one method for a week straight, after 4 weeks, its effectiveness will drop by 50%. They adapt. Rotation keeps plaque under stress. It doesn't know what awaits it tomorrow. Self-check tests. Do you see progress? Test number 1. Plaque in 30 seconds. Run your fingernail over the surface of your lower front teeth. If a white or yellow substance scrapes off, it's plaque. If nothing scrapes off, there's no plaque or it's very thin. Do this test every evening before bed at the same time. Record the result, plaque present or absent. Over 3 weeks, clear progression should be visible. In the first week, plaque scrapes off easily. In the second week, it scrapes off with difficulty. In the third week, it barely scrapes off. Test number 2, gum bleeding in 5 seconds. Press on the gums between the tooth and cheek for 5 seconds. You are a warm, friendly storyteller speaking to a YouTube audience. If there's blood, there's inflammation. If not, it's good. Do the test twice a week, on Monday and Thursday. Bleeding should disappear in 2 to 3 weeks with proper treatment. This is the first sign that the gums are healing. Test number 3, breath odor in 10 seconds. Lick the back of your wrist, wait 10 seconds, sniff. This is the smell of your breath. If there's an odor, plaque is actively producing volatile sulfur compounds. Within a week of using the methods, the odor should decrease by 50%. This means the number of pathogenic bacteria is dropping. Common mistakes and how to avoid them. Mistake number 1, brushing teeth immediately after acidic drinks. Juice, coffee with lemon, soda, enamel is softened by acid. The brush erodes it. Solution, wait 30 minutes or rinse your mouth with water before brushing. This neutralizes the acid. Mistake number 2, a hard toothbrush removes plaque better. False. You are a warm, friendly storyteller speaking to a YouTube audience. Hey, so I've got some really important information for you about how to take care of your teeth. And trust me, this stuff really works. Okay, so mistake number 1, using a hard toothbrush. A hard toothbrush causes micro-traumas to the enamel and gum recession. Plaque remains precisely where the brush was hard. Solution? A soft toothbrush with rounded bristles. This works more effectively. Mistake number 3, skipping dental floss. A toothbrush removes plaque from only 65% of the tooth surface. Interdental spaces account for 35%. Solution? Floss daily, even if your gums bleed. Bleeding will disappear within a week. Mistake number 4, using methods for only a week, then stopping. Plaque requires 3 to 4 weeks of consistent work for visible results. Solution? Set a reminder on your phone for 21 days. After that, switch to prevention. Mistake number 5, thinking one method is sufficient. Different methods act on different types of bacteria. Solution? Alternate methods throughout the week. This is synergy. Checklists for monitoring. Daily checklist. You are a warm, friendly storyteller speaking to a YouTube audience. You are a warm, friendly storyteller speaking to a YouTube audience. Rinsing with water in the morning? Rinse for 1 minute. Brushing teeth twice? 2 minutes each time. Flossing twice? 2 minutes each time. One of the methods, oil, orange, or guava. Rinsing with water after meals? 1 minute. Slept on the left side. If 7 check marks, the day counts. Weekly results checklist. Check every Sunday. Plaque is lightening. Compare with photo from day 1. Gums bleed less. Pressure test. Bad breath has reduced. Wrist test. Stickiness on teeth is gone. Run your tongue over them. Teeth look whiter. Look in the mirror. If 4 to 5 check marks, the process is going correctly. Checklist before visiting the doctor in the month. Took photos of teeth on day 1 and now. Recorded which methods were used and how often. Noted which symptoms have improved. Prepared questions about professional cleaning. Found out if vitamins and supplements are needed. This is a system, not magic, but simple mechanics. You are a warm, friendly storyteller speaking to a YouTube audience. 3 weeks and you will see results. 3 months and plaque will return to normal. After that, only prevention and your teeth will be like new.